The Affordable Care Act, also known as the Obamacare Plan, is one of the most mainstream media topics. According to the New York Times, CNN, and other articles, primarily the ones that I reviewed and looked at the most were the Obamacare premiums are set to rise, thanks policy uncertainty, and when silver costs more than gold, how Trump's actions have scrambled insurance prices. Um, Basically, what it's saying is that the Trump administration has created pricing chaos by eliminating cost sharing subsidies, a payment to insurance companies that was tied up in a legal dispute. Now, what cost sharing subsidies are, they are when the government and the policyholder or the insured person, when they're sharing cost of the health care. So that's what cost sharing subsidies are. But what it also says is that it has also taken steps to limit the damage that is creating the reforms that they're trying to make. And what it has done is it has permitted states and insurers to change their steps to, states and insurers to change their prices at the last minute to compensate for the change. It made price information for next year publicly available a week earlier, so customers could have more time to window shop and explore their options. I know recently my husband and I both received our health care information through the mail, and that was quite, it was earlier than when we normally get it. I know open enrollment usually starts for most companies in November. However, we did receive information sooner than we did last year. Basically, the current health care policy that we're under now is the Patient Protection Affordable Care Act, that's PPACA, or it's also known as the Affordable Care Act, and also is known as Obamacare. And the main objective of this policy was to improve the standards of health services and make it more affordable for basically everyone. Additionally, the policy aimed at reducing the health care expenditures of the country. This policy increased the prospects of health insurance for many Americans who were initially deprived of it. So it was a really good policy. It assumed to provide ease to the health problems or health insurance of all people in the country, being that it was it was a large number of people that were uninsured, that were unable to get health care. So that's what the Obamacare Plan and Act did. That was the implementation of that act. However, Trump is repealing the policy, and the implementations of Trump policy are based on many assumptions, and it will actually put the country in worse shape than what it's in now. The damage is estimated to the health industry, the health of the people, and the costs associated with them are expected to increase even further. So what some of these things of the some of the things for the Trump care plan that remains the same is, or that's a strength, is that some of the bills are still taken from earlier presidents' provisions. Not all of the provisions are adopted by Trump, but it only takes the essential health benefits. Trump does not remove the previous good provisions, so he did leave some of those in place, and there are still some of the Obamacare provisions that are still in place as well. Another good thing about it, or the good things, the strengths, the weaknesses, the strength, one another's strengths is that it's helping all of the people according to class level, especially those in the middle class, because it will give significant help to anyone that was not yet covered. Also, it will begin to get rid of some of Medicaid funding, and it may give Democrats the chance to expand their government. There is no longer a fee needed for those who do not have insurance, so that's definitely a strength. Trump's policy revision will still keep the mandate, only removing the fees. Trump allows insurance services to provide insurance across state lines by reducing the plan's cost, despite the fact that it may cause less protection to the user. Also, this is a fresh healthcare service with some interesting plans, such as giving permission to insurance companies to sell over the state lines, blocking Medicaid grants, making a sick pool, and decreasing healthcare litigation. Many people may think that those policies are bad if the Trump government does not conduct the things properly. Or the people may disagree if it causes the poor and sick to starve and suffer because they do not get funds in time. Trump is really beneficial for large company owners, and the bill will try to reduce the tax burden for those business owners. But for the small employers, this is not so, and pretty much most of Trump's campaigning and policy implementations has been geared towards the more wealthier people or the Republican parties, which is not a shocker. But some of the weaknesses of these policy revisions that Trump is trying to implement is that it makes poor people suffer more, only making big employers and rich people happy. There are still many poor and sick people in the country that need help, but the policy revision is not on their side. The consumer will pay 30% more for 1 year, just in case they have a lapse in coverage for more than 2 months. So if you have a lapse in the coverage of your insurance, that's going to be hurtful to you. But since Trump does not really, his revisions do not really belong to a universal coverage, the people who do not get covered by insurance will rise up as time goes on. So healthy people may not be incented to join the market, and most of them apparently get covered by Medicare and work, while a lot of the young people need to wait so that they can get coverage. Pretty much the recommendations and reasonings for these revisions is that Trump argues that Obamacare represented government overreach. He was stating changes are recommended to look for ways to expand the use of association health plans, groups of small businesses that pool together to buy health insurance, and to broaden the definition of short-term insurance, which is exempt from the Affordable Care Act's rules. The plan that Republicans described was socialized medicine was denying choice to, and that a free market solution would bring the cost of health care down for all. I think as social workers, what we can do is we can advocate for our clients to make sure that they are knowledgeable of what the policy revisions are and how it would affect them. Thank you. I'm Michelle Shelton. Have a good evening.